preventing individuals from making personal health care decisions. And then we've heard a lot about how important that is. And ceding those decisions to government bureaucrats is really the violation of fundamental human rights. And one must acknowledge that inherent in President Obama's statement that if you like your health plan, you can keep it, was that recognition of that human right to make your personal choices. I mean, that's why he said that, because he knew that's what we want. We want to be able to choose our health plans. But that was a lie, and he told that lie because he wanted to get his Obamacare, ACA, whatever you want to call it, plan out there. Which is interesting to me because repeatedly I've heard colleagues across the aisle say today, the system is broken. This is the system you designed. This is the ACA. We're all living under it now, one way or the other. It's your system. Dr. Sachs said it's broken, it's unfair, it's too expensive, there's too much administrative costs. I agree with everything you said there. You're exactly right. But this is the system that my colleagues across the aisle made. Even in the private industrial sector, in the private plans, the administration costs are too high. They are way too high. And part of that is because of the regulatory environment that mounted on the previous unworkable regulatory environment that was imposed through the ACA. The good doctor repeatedly mentioned peer countries. But when you talk about single-payer systems or socialized systems, although apparently we're not supposed to call it that, there really isn't a peer to the United States. Just the size of the United States mediates against that. The peer countries in population size or cost of health care and expenses paid are not comparable. There is no peer country on the charts that you were putting up there. Go back and take a look. The scale of a Medicare for all plan would be unlike anything you've seen in the history of the world. And scalability is a problem, but the inherent problems can be even in small states. I mean, so when Vermont tried to implement its single-payer experiment, that failed under the costs. Now, we all say, hey, yeah, everybody should be able to have access to their health care. We want it to be affordable. But Medicare for all would make our ability to buy private insurance even more difficult than it is to buy private insurance in Canada. And it wouldn't necessarily guarantee that you're going to reduce costs. I mean, let's take a look at Medicare and pharmaceutical costs. They're way up. They still remain high, even under Medicare. So I think so much of what I've heard today is talking around the issue for political purposes. If you want to solve problems, I'm willing to talk and let's solve problems. But I've told today that all the other countries have solved their problems, and I don't know that I believe that. There are lots of studies and science that indicates that's not true. Let's take a look at one specific. Let's take a look at one specific issue, and I don't know who's interrupting me.
That was me, Professor Sachs. I was.
Yeah. I'm not asking you a question, sir. I'm not asking you a question. Please don't interrupt me.
Okay.
In 2009, Medicare cut payments to independent cardiologists. This is what we call an unintended consequence for people who don't understand economics. 2009, Medicare cut payments to independent cardiologists for common tests, but left untouched their payment for cardiologists employed by hospitals. So what do you think would happen? Some imaging services Medicare paid hospitals nearly twice as much as they paid independent physicians for the same service. The effects were predictable. The percent of cardiologists employed by hospitals rocketed. People received many more cardiac imaging from hospital outpatient departments and less from freestanding physicians' offices. That is an unintended consequence. So I'll turn to you now, Ms. Turner. What effects would Medicare for All have on patients' ability to receive care in a timely, affordable fashion?
I can't agree with you more about the comparison the Swiss system works fine for Switzerland. It's the size of Massachusetts. That is not something that we can impose on this whole country. We must have diversity. And I think people value not only diversity of places to get care, but they also they value diversity of how that care is going to be paid for. And giving people more options than they have today, as we see fewer and fewer, because so much of the spending is controlled by government, federal and state government, rather than by patients, and rather than seeing what innovations could come to provide people with more options of portable coverage that they own and take with them and that they can afford to keep, with a strong safety net for the vulnerable.
The gentleman's time has
Thank you.
expired. Thank you.